the function of his fertility, the function of his sperm was high. So in this day and age now, you have younger people, even men, that have the sperm, but it's not functional. So everything boils down to the quality over quantity. You know, a lot of people want to blame the age. It's not the age. So one of the common things is over 40 people say I have the low testosterone. Well, no. You have the low testosterone because of what you did when you're 30. Oh, what is that? Oh, when you don't sleep, your testosterone goes down. When you have extra body fat, you convert your testosterone to estrogen. When you have more than 2 cups of coffee, it converts testosterone to estrogen through aromatase. When you wash your hands with soap, to calcium, that converts testosterone to estrogen. So it's not what happened to you at 40, it's what did you do to yourself when you're 30 and 20. So I call it the golden 30s, because in your 30s, you are the most productive. You're at the top of your career, hopefully, educational. You open your business.
You're ascending.
You're ascending, right? In what you perceive as success, you're ascending. You're making money.
Whatever that may be.
Right. You have assets, car, bigger house, a car. You have children. That's an asset, a nice one. But it has demands. You know, they wake up at night. They have issues. So what am I saying? What I'm saying is you have sleep deprivation. You have stress because you're creating that stress. What you believe is success, and I'm not countering it. All I'm saying is that we have to understand where the problems come from so we can make better judgment. So that's why I look at myself is I give information for people to make their judgment. I don't tell them what to do, what not to do. Give them the fact. So the number one reason for people to have low testosterone is not enough sleep, or worse still, sleep disruption. One of the diseases is called sleep apnea. 100% of those patients will have low testosterone. And those are people who choose to go to bed late. That's volitional, they choose. And there are others that go to bed, but they can't stay asleep because of toxins, because of things interfering with the neurological system. And then there's obviously the more complicated things, as I said, that what happens to testosterone when you have too much body fat? What happens when you have too much coffee? What happens when you wash your hands with soap? Those are just some examples. So when people say, what can I do? Look, I'd like to tell you the best herb in the world, but it's not going to be that potent. I can tell you take testosterone, but that's not a solution. Because if you keep taking testosterone, your body will completely forget how to make it after about 6 months. Just like sleep. If you have sleep disturbance and you take a sleeping aid, after a while the body will forget how to sleep. And that's after another year. So a year of taking sleep aid, good luck to getting your sleep back when you want to stop taking the sleep aid. So you should use the sleep aid very carefully and infrequently, only as needed. And testosterone, again, very infrequently, only as needed, but more importantly, ask yourself why people have it. And the number one is not the age. It's sleep disturbance, sleep problems, or choices, or interrupted sleep. Then sometimes if you have excessive exercise, so we've found that endurance athletes have low testosterone.
Because they push themselves so much, right? Testosterone
is a steroid. So when your body's in the demand, it needs the steroids. And then you have to ask yourself, where does testosterone come from? Cholesterol. If you don't eat cholesterol, good fat, how are you going to make it? And then they keep telling you to take cholesterol-lowering pills. So if you have a total cholesterol less than 150, you might actually have more problems down the line. Again, this is what we postulate, and the facts will come out, just like everything else. There's a lot of thoughts about holistic medicine, which we just used to think they were holistic. Now the facts have caught up. It's like, yeah, we were right about that. And so testosterone is one of those 40-plus symptoms. The other one I'm going to talk about later on is erections and low nitric oxide levels and how it relates to higher blood pressure. That's, again, another 40-plus myth. These are all 40-plus myths. Age is not related to disease. As you get older, you get older. At one point, you will die. But disease has nothing to do with aging. Your function goes down in a physiological manner, but you should still be able to run around at the age of 80, have erections, go to sleep on time, wake up rested, be able to do weight training. And anybody that can't, they did something wrong. End of story.